So Daniel, as always, thank you so much for joining me. My goal for today was to get into discussions about AI specifically in healthcare, AI scribes, AI documentation, and then also if you have any information about kind of what's going on with AI as it relates to third-party payer using it for reviews, for utilization management. Like I'm a huge advocate of AI. Obviously, I share a ton of content, but I don't know anything on the compliance side. So you lead the conversation. What do you think are some of the most important things clinicians in the clinics need to know about AI compliance, utilization, along those lines?
Sure. Well, first of all, thanks for having me again. Always love speaking with you. So this is a great topic. It's a great timing of it because it'll probably be out of date by the time most people watch this. Even just last week, right? The APTA put on a legislative session, and the major take-home message was that, hey, buckle up, right? There's a lot that we thought was going to happen, a lot didn't happen, and now we're back at the fight. But that being said, we know that the main concept is always revolving around from HIPAA privacy, security. It's always the same thing. It's always protecting that information, the access to that. So when it comes to scribing, I know obviously you have a favorite. They've been around for a few years now, and I think it's really, really important to focus on, are we securing that data and the access to that information? It usually starts with consent forms, and it always ends with encryption, multi-factor authentication, things like that. So those components to this to safeguard the information is really, for instance, like Europe, I know they have legislation that has been passed, but the US still is kind of lagging behind in really agreeing on anything. Different states have had different proposals right now, so there's nothing overwhelming that at the federal level you could say, yes, we've done this, we haven't. To your point, though, obviously United made big news, right? Last year, or maybe even 2 years already, when they were routinely, right, they were using this great technology for evil, which you could say that about almost everything, that it could be used for good or it could be used for not good. And they clearly were doing this to routinely deny and just for profits. So
for people who don't know, what you're talking about, give us a little bit of context around what United Healthcare was doing, what the headlines are saying.
Sure. This was, I think, in 2023, that UHE, there's a class action lawsuit against them. And it was basically that they were using AI, artificial intelligence, to deny claims with NaviHealth. So they were using this information, which it could have been, again, done in a great way. And it's about, are beneficiaries receiving the benefits that they're entitled to? And that was pretty much the problem, where they were saying, well, what was the error rate? How were these denials being made? Was it ethical? So all these questions that come into consideration, it kind of pushed the conversation into this realm of, hey, by the way, it could be used for really, really good, or the largest payer, right? They own more doctors than anyone in this country, for really, I consider it evil. This is something that people, they believe that they purchase these benefits and they're supposed to be utilizing them, unlike insurance, right? Like life insurance and other types of vehicles of insurance, you don't want to use those, right? Those are not supposed to be used until you absolutely have them. Health insurance is to maintain a healthy lifestyle, and that's kind of what our profession does really good at, right? We're always trying to promote healthy decisions, and if you have one of the largest payers saying, you know what, we're just going to use technology to start cutting away and chopping up, that's not good when it comes to benefits.
Awesome. Yeah, I remember reading about how payers were no longer allowed to use AI to process and review and deny claims. I can't imagine how they can get through the billions of claims that they process without some sort of AI. So I don't know what's going to happen on that side. Talking about documentation specifically now, like you said, there's a ton of scribes on the market, and it's a constantly evolving landscape. What would you say are some of the things that a therapist who isn't well-versed in this world yet, what are some of the things they just need to be aware of? They need to be looking at, they need to be considering when they're thinking about, hey, I can't keep up with my documentation volume. I want to explore an AI scribe, whatever the brand, whatever the model. What are some of the questions that they should be asking these companies?
Sure. I've heard you speak about this a few times, and I think we're on the same page. It's really about, does this make your life easier? And does it make sense, right? You have to do the return on investment. So this is simply, we all go to school, we all work hard for our degrees. As a physical therapist myself, I could tell you, nobody goes for documentation, right? They don't come out of school going, wow, this is amazing. They really say, how do I improve my skills? How do I improve my patient management, my time management, right? All these things that go into it, and then scribing fills that void. And again, there's so many scribing options right now out there, but they have to ask the question of, does this work into what I'm trying to solve for? And if it's, if you're looking for certain data points, if you're looking for billing assistance, if you're looking for like predictive analytics, if you will, of saying like, hey, how do I make this better? Just like ChatGPT or some of the other chat options that are available for AI right now. You have to figure out which one makes sense, and then obviously do the math, because time is money. So if you're wasting more than, I think right now it's roughly between 90 seconds and 3 minutes on a daily note. If you're burning more than that to create a decent average note, then there's a problem, right? And that's not going to be solved with technology. That's going to be solved with just filling this void with technology to help us. APTA has put out tremendous information already on this, which is kind of unique, I think, because they're usually one of the last organizations to kind of come to light with advancing technology. But they've put out some really good guidelines to say, hey, by the way, everyone take a deep breath. This is not going to be taking over our profession. This is just supplemental to help us as we try to be in this year, in this decade, right? So I think the questions that have to be answered is simply, what are you struggling with? So are you struggling with time? Is it just costing you money to keep your patients, or rather your therapist, on staff in the clinic? Because, for instance, I'll give you an example. Someone told me that in their practice, they're having trouble with their providers want to just treat the number of patients and then go home. But they don't care how long it takes to do that. And I said, well, actually, that's a terrible idea, because then you're incentivizing really bad care or lower quality care possibly, because you could just flip, right? You could flip around and say, hey, let me squeeze in X amount of hours, which you don't want. You want quality care. And there is a fine, window, if you will, between maybe 30, 40 minutes, maybe a little bit longer, depending on your patient population. So there's variables that go into that. That's my take home that I'm trying to express, that there's variables that go into it, but depending on individual practices and the owner's pain points, you could easily fill that void now, which is rare, because there's very few times in recent history that we've had the technologies to actually solve the problem. And we have that with AI.
Yeah, I'll tell you, and I'm privy to a lot of different EMRs and EMR platforms and AI scribe platforms and all that kind of stuff. I get a lot of inbound, and I can tell you that still to this day, even trying not to say anything negative about an EMR, any EMR, I haven't seen an EMR that makes my life better, period. There are elements or aspects within the EMR that do improve certain workflows and certain things. But overall, I have not found an EMR that makes my life better as a clinician. I have found AI scribes that make my life dramatically better as a clinician.
And do you know why? The reason is because everyone's trying to build different components to that EMR and trying to make therapists do more than what they're supposed to be doing. So as an example, I'm not going to pick on an EMR either, but there was a EMR that doesn't exist right now. They were requiring therapists to do billing, right? So they're asking every single data service to apply a modifier and we're not billers, we're not coders, we're therapists. We're highly skilled clinicians to be able to provide this type of care. And once you start adding in other components to just simply, scribing takes care of documentation. It could even give you a really good recommendation. That's the future. And I think the quicker we embrace that to say, this is what we can do and save time with that, I think it's a good thing for overall.
Yeah. I want to go back to something you said, because you said it really fast and I don't think we caught it. How much time did you say would be the expectation for documenting a treatment note, a daily treatment note?
Sorry, I do speak quickly. It's between 90 seconds and 3 minutes. So that's,
I mean,
if you're burning more than that time, we should talk.
You are going to blow minds out there. Really, you're probably not, because anybody who disagrees with you is probably going to think, how could you possibly document in 3 minutes? I agree with you. I think if we understand the function and the purpose of documentation, we understand the specific third-party payer who we are documenting for, we take into account the State Practice Act and the other parties involved. I agree. 90 seconds to 3 minutes is absolutely within reason. Do you
It's
have
not a
any numbers or metrics on documenting the initial evaluation?
Yes, I do. It should be roughly between 10 and 15 minutes to actually complete the eval, and to be able to document that, usually another 5 minutes. But yes, that's give or take. I could tell you firsthand, I've heard Medicare say that it should take at least 30 minutes to document an eval, which makes no sense to me. Again, based on what they're reimbursing and what their guidelines are, again, and this is literally, they went on record to state this, and you got to just shake your head going, what are they thinking? Where's the disconnect?
Where did that come from? I've never heard that.
Yeah, it was I'll send you one of the links. It's they put on these they're one of their Macs, so they put out this information on PT, OT, outpatient coding. So they went on record with, yes, exactly. It's very confusing to me. But the take home again is really that it shouldn't be a burden. This is not drastically changed in a long time, but the technology has. And that's why it should really, it's a tool on your tool belt. And we learned about other things that we can do for improving patient outcomes and other things. And this is a way to enhance our ability to focus on what is really important.
So now let me ask you about what everybody's so concerned of, me included. You rely on a company that comes out and they say, we are HIPAA compliant. You know, EMR companies say we're HIPAA compliant. Scribe companies say we're HIPAA compliant. You hear these things. Of course, you sign a business associates agreement, but like, what does that even mean? I mean, help us kind of navigate that. I know what the answer is. Do we just rely on them saying we're HIPAA compliant? I mean, how do we cover ourselves and make sure we're doing the right stuff on our end?
That's a great question. So there's two ways to answer that. One is you have to, when it comes to privacy, security, there's a reasonable standard that has to be applied. So just because other companies are doing one thing and then you hear someone else down the street doing another, it doesn't matter. It's the ATIs of the world are not being compared to the mom and pops of the world. The standards are not equally applied. The enforcement, however, so to answer your question in another way, is when you're trying to make sure that you're complying, yes, you should obviously go with a HIPAA compliant product. The BAA does protect you. You should have insurance, of course, that also protects you from this, but making sure that you have certain features in place, and that is encryption, multi-factor authentication. So there are absolute things that you have to do as an owner to make sure that you're protecting what you're doing. And also on an annual basis, there's free security risk assessments that you should be applying to your practice. And again, it's not a pass-fail. It's simply that you just have to take this as a workflow almost and say, hey, by the way, where's my exposure? Where's my areas of risk that I could address? And if that's with your vendors, great, then you could deal that with your vendors. But if it's internally, then also, hey, maybe work with IT internally to make sure that you have functionality to prevent any kind of breaches or anything that could be identified and prevented. But that's the standard. That's the baseline to say you have to safeguard the PHI. And again, if your vendor is claiming that they're doing that, you could verify that. But again, you're not supposed to be an engineer and going in and actually looking at the coding. That's not your responsibility.
And I'm sure my risk assessment is outdated. Do you guys have a risk assessment on the website, or where would you send people to find it?
We have one, but the government has one as well. And I'm happy to give you the link that everyone can just download themselves.
Awesome. We'll go ahead and share it. So let me ask you then, what are you seeing? And I don't know if are you involved or your company involved with reviewing documentation at any point? One of the things that we've been seeing, an uptick in the number of TPE audits, post-payment reviews, an uptick in requested documentation. A lot of therapists are, going out there blindly. This blows me away. I saw a therapist get a request for documentation and say, I don't think I'm even going to bother complying because I heard 90% of them get denied. And I was like, oh, I didn't even, that wasn't even on my radar. I didn't think that somebody could actually think that. So that being said, do you guys do any like review of documentation or any service like that within the offering that you have?
Sure. That example, by the way, sounds just like an unforced error. That doesn't make any sense. Always follow the instructions. That's rule number one. Follow the instructions that you're given, and don't paint a larger target on your back. Yes, we do sadly still do manual reviews. I'm hoping that day comes to an end pretty quickly. People don't like going through manual reviews, just like payers are still doing them. I can't foresee this living very long in the future. Mostly because we have technology that has already proven to be better than humans. It's more accurate and it's more transparent, which is great. So the whole auditor bias, we see that a lot with TPEs, right? So we see oftentimes you get these back and forth between the different rounds of some person's opinion telling you that they don't like the way you write. That doesn't make a lot of sense, right? In this day and age, we shouldn't be relying on someone's personal opinion to be interpreting a rule to say, I don't like how you're documenting maintenance. Like, there's no code for it. So why is your opinion better than my opinion?
Yeah.
Is it medically necessary? Well, let's just all move on. So yes, we still do that though. We provide a great service. We've done, again, we're close to 80,000 charts that we've done to date. And again, hopefully it ends very quickly because nobody likes doing it. But yes, it's something that everyone should be doing on an annual basis. If you're using AI, if you're using a platform to do that, fantastic. And if you're still doing chart reviews, please stop the peer-to-peer reviews. I'm going on the record. I don't like people wasting their lunches. I'm probably the one compliance officer to preach this. They have to stop doing peer-to-peer reviews. The evidence says it's worthless. You're not getting it. You're not getting any return on it.
And so when you're saying that, you mean like if I have a team of 5 clinicians, you mean like clinicians on my team reviewing my documentation and me reviewing them. You're not talking about bringing an outside person in.
Right. Because everyone did that for 20, 30 years now. We all did it. We all think that's normal. It used to be normal. That used to be okay. But the truth is, the history, the evidence now clearly shows that is not moving the needle in any positive manner. A third party, a fresh pair of eyes is usually more effective, more efficient. And you should probably just go with people that's all they do. You should just find the experts that just do that.
All right. Awesome. Well, look, I already took you a couple minutes over what I told you I would take. One more time for people who maybe don't know, what is the best way for people to connect with you?
Sure. You can just go on my website, riskandcomplianceanalytics.com, or just Google outpatient private practice physical therapy. There's only about 12 of us that even do compliance in outpatient PT. But yeah, happy to jump on a call with anybody if they have any questions, and I'll shoot you over the links for the security risk assessment.
Awesome. Thank you, Daniel. Just hang out. I'm going to wrap this show. So guys, you're not out there by yourself. Like, take advantage of the resources that are there. Daniel's company does an amazing job. Daniel, I'll have you on probably next month. I swear we need to do this monthly.
You got it. Happy to join.
All right.